So a concept which has become increasingly popular over the last year or two is this idea of an internal bra within breast augmentation surgery. So the concept itself is basically using a system which, very much like an external normal bra which holds the implant and breasts up, we utilize something internally to try and help do the same thing. In principle, there are two ways of doing this. Number one, using a suture system, and number two, using a mesh system. The suture system is something that I use throughout my breast surgery practice. And this is where we use dissolvable sutures to secure the skin or the tissue within the skin called the fascia to the chest wall. And by securing this to the chest wall, not only does it stop implants from slipping down the chest wall, but helps maintain their position on the chest wall a lot longer than it normally would. So certainly in my cases for breast augmentations with a lift, or just lift procedures themselves, I routinely use this to help maintain the longevity of the final result. The second system which is used is that of a mesh. Now, when we have patients who come in who've had breast implant surgery done previously, or if they've had massive weight loss, then the quality of the skin that they have is actually very, very thin. And what this means is that when we replace the implant, the actual tissue is so thin that the implant itself can become quite visible. In addition, the tissue is actually very, very weak. So its ability to hold up the implant is also compromised. And so the risk of the tissue slipping down the chest wall or the breast just looking a little bit saggier a lot quicker is also high. So in this situation, we use a mesh. And what basically the mesh does is secure one edge of it to the chest wall and the other edge to normally the muscle, and it basically acts as a hammock. And very similar to a bra, it really does just hold the implant up. Now, these mesh systems can be permanent, such as the tie loop, or something which dissolves over an 18-month period, such as the Galatea or Galaflex system. Now, I'm not saying that they will hold the implant up in that position forever, because they don't. However, the rate at which the implant drops is significantly reduced, so you can expect that final nice outcome to last maybe twice as long as it normally would.